This conference will now be recorded.
All right, everyone, providers, most of you are providers, I think. Thank you for joining us today for this peer-to-peer networking meeting. Every once in a while, we like to get providers together around a certain topic. Sometimes we try to bring some guest speakers in. So Heidi's been with us a few other times here in Region 4, and I know that she helps out with other regions around the state. So great to have her on for the newest guidance or to answer your questions around health and safety. So before we get started, just a few housekeeping things. You can mute or unmute yourself along the bottom there. We do ask that you remain muted unless you have something to share. You can either unmute and just go ahead and talk to us. We'll have lots of time for questions, or you can go ahead and use the chat box, and I will keep an eye on that so that I can read out any questions and Heidi can help answer them. So my name's Julie Davis. If you haven't been on a peer-to-peer before, we've had a lot of them. I'm just the community development specialist, so really just advocating and educating about quality childcare and helping to give providers the opportunity to connect around certain topics. So welcome Heidi Hotvedt. She is the Healthy Childcare Iowa Coordinator for the Iowa Department of Public Health. I'm going to go ahead and give you the screen, Heidi, and then you can go ahead and introduce yourself however you'd like.
Great, thanks for having me. I'm going to go ahead and share my screen here. And let's see. So hopefully you can all see my screen.
Yep.
You already have my contact information, so we're just going to jump right in. And how we've done this in the past is if you have a question about a specific slide, it's great to either put it in the chat. Julie, I know, will monitor those for me. And then, or you can unmute and just ask your question. So just wanted to kind of start off with vaccination. We're still encouraging everyone to get vaccinated, and it's an important way for you and your staff to stay safe and reduce the risk of getting seriously ill from COVID. Iowa Department of Public Health in the state of Iowa, they have a new vaccination location. Like find your location and you put in your zip code, and that's the vaccineteiowa.gov website. So I have that on the screen. And then there's some additional information available on the website, some frequently asked questions, which I think is really helpful for people that have specific questions about the vaccination, to go ahead and click on that site. And it's just the same, vaccinate.iowa.gov, and then it's under the Know the Facts. And I did want to share that the CDC has some great vaccine posters. I have on the slide just a picture of one of them. But they have some great social media with graphics and posters and things. And I think it's just helpful to kind of, show that you're committed to health and safety in your child care program, and that you, whether your staff have been fully vaccinated, or maybe you have some that have and some that haven't. But I do think it's a way to just promote that vaccination is important to you, and keeping kids safe in your care and healthy is important to you. So if you'd like to share those graphics either through, if you have a newsletter that goes out, or you use social media with your parents and providers, to go ahead and utilize those resources for free on the CDC website. And I have that toolkit for schools and childcare link right there on the screen. I'm not seeing any chat, so I'm just going to keep on going here. So just wanted to talk a little bit about the child care guidance that was updated over a month ago. So many of you have already had experience, looking at the guidance document, asking questions about that, maybe with your CCR&R consultants or with your child care nurse consultant at the local level. But I thought we get kind of repeat questions on certain areas. So I thought I'm going to go ahead and address some of those things that maybe have come up, and maybe they're questions that you have had. So just a few things. So we're still, from the beginning of COVID, so from the beginning of the pandemic, which I know seems to have lasted longer than we all thought would happen. We want to make sure that staff and children are not admitted into childcare when they're ill. So that's probably the biggest thing, is just we're still following that. That hasn't really changed. You know, if children are ill, if staff are ill, they really need to refrain from being in care. And then, you know, kind of walking through that, you know, how long do they need to be excluded? Is it just for today, or is it going to need to be longer? But that we're still doing that. Now, many programs are continuing to do assessing kind of at the door, or doing that kind of health screening at the door. And, you know, that is best practice. And we always encourage that. Even prior to the pandemic, that was a best practice for programs to do health screening of all children coming into care. But it's no longer a requirement, so it's not required as part of our child care guidance, but it is still a best practice. So that's really your individual decision if you would continue that. We do still have that unvaccinated individuals are encouraged to wear face coverings as medically appropriate. So it's really your, you know, I know our state, you know, has said that we don't have a state mandate for masks, which is been really appreciated, I know, by a lot of individuals. And we have not had, our cases have gone down in our state, so our community spread has gone down, and that's exciting to see that. And that really is as a result of the continuation of individuals getting fully vaccinated has really helped. But, you know, there is still in the child care guidance that unvaccinated individuals can be encouraged to wear a face covering, because it does help to protect them for a potential exposure and protect others who are unvaccinated. And we know that at this time, children are not vaccinated. The children that are in care and in the age group that we serve, they are not able to be vaccinated. Providers are encouraged to allow parents the opportunity to make that decision about mask usage for their child. I would say that that's really been, you know, some challenges, I know, for some programs where maybe they still had a mask mandate, you know, kind of in place, or they wanted to have masks in place for staff and children. But that's just something that we really encourage you to allow parents to have that opportunity to have that discussion. And I think it's really having that opportunity to talk about what your program's policy is, and to talk with the parents about their feelings on that. And then we do want to make sure that all children younger than 2 years of age, that they are not wearing a mask. That has been from the beginning. We have had that come up. We've had that question come up where maybe a parent wants their 18-month-old to wear a mask, or they want, you know, a younger child than 2 years of age to wear a mask. And in childcare, you know, it's the parent's choice when they are, you know, under the care of their parent. But we do say that there is a risk, and that CDC was really clear about that children younger than 2 years of age should not be wearing a mask. So we would like you to follow that. We are still saying discouraging the use of shared items that are difficult to clean and disinfect. I know that dress-up clothes have probably been the biggest thing that we have had for questions about this, but I will say I was on site at a child care program a few weeks ago, and how they were handling that was they had dress-up day, and each child was able to bring to wear what they wanted to dress up in for the day. You know, another way you can handle that maybe would be to have several, you know, if you're going to do dress-up clothes, maybe have several different dress-up clothes available, and that the children have to kind of choose that one for the day rather than sharing it between children. So that's a way to kind of work around that. Some of those other shared items, water play, I know always has come up, especially that we've had some really hot days, water play, and really not sharing some of those items, you know, between children. Now between groups, if you can, you know, use your disinfectant to clean the items between, you know, the different age groups that are going out to water play, or if you're having water tables, you know, that you're dumping the water, you know, before the next group uses that. That's a way to work kind of around that. Water tables, you know, do have a little bit of more of a risk, and I will just say that, you know, we're not saying that you can't have a water table, you know, for kids, but that water tables, and we know Children like to sometimes drink the water, or if they use their cup and then they're drinking the water, and you kind of catch them in the and try to encourage them to not do that. But we know that younger children especially tend to like to do that. And so saliva is a transmission issue for COVID. So we know that, and based on information from the CDC. So that's part of the reason that we've said to, try to really think about that. If you're going to do water play, could you just do, some little sprinklers, some, individual watering cans. I mean, kids love to do that. And those are pretty inexpensive to be able to get those from, your local, discount store, that kind of stuff, so that kids can have fun. Still, we still want kids to have fun, but to try to limit that sharing of items. And then I know the question about bedding, initially in our child care guidance, the bedding, we wanted that cleaned daily, and that is weekly. So I just wanted to make sure, or if it's being used by another child. So if it's going to be a shared thing, you would need to wash that between that. There is a link on the child care guidance now to the Healthy Child Care Iowa Common Child Illnesses and Exclusion Criteria for education and child care settings. So that is a guidance fact sheet that we've had on our website for quite a number of years. I would have to go back, possibly even 10 years. We've had the Common Child Illness and Exclusion Criteria. And so COVID was added to that. So that now is on that form, and it's going to stay on there. For the time being. So I just wanted to let you know that link is in the child care guidance. And I don't see any chats right now. So Julie's just going to encourage me to keep going.
Yep.
I know it's a lot of information. So I just want to talk a little bit about that. I do see a chat. Can you clarify how long a child needs to be excluded? So yeah, let's talk about the child care exclusion guidance real quick, and that might answer your question. So, we talk about temporary exclusion, and that's usually, we kind of have some parameters around that for just general illnesses. So all illnesses. So if it prevents the child from participating comfortably in the activity, the need for care is greater than staff can provide without, putting the other children's safety in concern. And then if there's an acute behavior change, we always say, but they should be excluded from care. This guidance document follows the AAP fever definition. So that's a little different than originally, our fever definition for COVID was 100.4 or higher and or greater. And the common child care illness exclusion is based on the AAP definition for fever. So you might see that there's a little difference in that. But you're going to decide, from your policy standpoint, what your fever definition will be. Just to let you know, the CDC did take the fever, the 100.4 off of their website. They're not following, that they're just saying general fever, because we know fever can be different depending on the individual. So that has changed a little bit. For exclusion for COVID, so if the person has symptoms, test positive, they need to be out for those 10 days after symptoms have started. So that hasn't changed. And then, they have to be fever free after they, if they return. So they have to have that 24 hours fever free without using medication. So that's been, consistent all along. Now, the challenge that we get into is, what about those children or those staff that aren't tested? So they have symptoms of COVID, but they aren't tested. And so, we're saying that they really, if they want to come back sooner than the 10 days, that they would need to be seen by their physician. And we're encouraging testing. We're always encouraging testing. Now, we do have some children where maybe they have an alternative diagnosis from the physician. And if that is confirmed by the physician, then you could go along with what that physician has in terms of having that child come back. And that's a little challenging, because we've had that happen where a child's been diagnosed with something else, but then also ended up being diagnosed with COVID. I would say that that has changed a little bit in terms of the guidance document, that we are allowing to look at those alternative diagnoses is because we know that the community spread has really decreased in our state. So it's based on our numbers and the risk that the child would have, but we are still encouraging testing, and that has not changed. So you can ask your parents when they take their child in, you know, if they're not going to, maybe they're having symptoms of COVID, they're not wanting to have their child tested, but they are going to take their child into the doctor, then, you know, to just have that conversation with their child care provider about potential for testing to confirm that. I'm just going to go to the next slide, and then we'll answer a couple of the questions that I saw in the chat real quick, okay? So I just want to talk a little bit more about these symptoms and some things. So the Iowa Department of Public Health has an EPI manual that includes now COVID-19 as a reportable disease. So we've always kind of had that reportable disease list of diseases that we would be looking at that EPI manual, and that's something that is available it's on the Iowa Department of Public Health website, but it's something that you would definitely want to work with your nurse consultant on so that they can look at that, look up that information for you. It's not the easiest manual to find information, but I wanted to let you know that it's there. So in that manual, it's saying that, you know, excluding the ill children and staff and encourage testing. So that's in there. And then they're following the CDC list of symptoms. And we know, you know, people with COVID-19 can have a wide range of symptoms from very mild to very severe. So we're still going with those same symptoms that are listed on the website and on our slide right here, which is fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle body aches, headache, the new loss of taste of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. So that list has really not changed from the very beginning of COVID. It's been adjusted a little bit, but we're still saying that, you know, individuals that have those symptoms should and be encouraged, and that's what we're asking that you do, is to encourage testing. I'm just gonna, one more thing I kind of want to talk about before we answer those questions is just about vaccinated individuals. So that's a little bit different. You probably have some staff that are fully vaccinated, and we consider individuals fully vaccinated 14 days after completion of the series. So if it's a 1-dose or a 2-dose series, once the 14 days has gone, that they're fully vaccinated. And so, you know, that the CDC has information, and Iowa Department of Public Health is following this, that fully vaccinated people with no COVID-like symptoms, so they get exposed to someone who's positive, that they're fully vaccinated, that do not need to quarantine, which is great. we like that. But that doesn't mean that they're not still important. It's important for them to self-monitor for those 14 days. So they're fully vaccinated, but they did get an exposure to COVID. So they should be monitoring at least for symptoms. And if symptoms develop, then they need to not be in care, and we would encourage testing. We have had very few individuals that have had breakthrough for with COVID from being fully vaccinated, but that has happened. So we just want to say, you know, if someone is under, you know, they had an exposure, they've been fully vaccinated, but they start having symptoms, they start having a cough, they start having a fever, they need to be excluded from care and be clinically evaluated. However, if they stay with no symptoms, then they had the exposure and the vaccine worked because they didn't convert to having the disease. So that's just some information about that quarantine guidance, and that's the information that's in the EPI manual. And then I guess let's before I get into this next document, I'm just going to look at these couple questions here. So for clarifying how long a child would need to be excluded for a fever, and the fever considered 100.4, like I said, in that guidance document, there are some guidelines from the AAP about fever. So you'd want to look at that, and that would be up to your policy if you were going to have a fever still considered 100.4 or greater. The exclusion is that we would follow the exclusion criteria. A fever is one of the symptoms of COVID. So unless they would be seen by the doctor and potentially have an alternative diagnosis, or if if they had potential for a COVID exposure maybe in the family, and then they end up starting to run a fever. I mean, we are going to say we're going to follow the guidance that says the 10 days they should be out. But we would really encourage, if they get tested and it's negative, and this isn't changed, if you have a symptom of COVID and you are tested and you're tested negative, then we go with the exclusion for a general illness, not the COVID illness. So that would be Cassidy, I hope that answered your question. And then Terry asked about sand play. And Terry, I'm just gonna write myself a note and double check on the sand play. My understanding was that as long as children are, washing their hands before and after, that sand play is okay. A little bit different than shared items in terms of putting something, like in their mouth or something like that with sand play. But I will double check on that, and then I can send that to Julie, and maybe she could send that information out. Is that okay,
Yes,
Julie?
absolutely.
I will check on that. So I haven't had that question for a while, but I just wanted to double check. And then I don't see anything else in the chat at this time, so I'll just keep moving unless somebody needs to unmute and ask a question. Okay, hearing nothing, I'm going to go ahead and go on. So, I see one that just came up here. Nancy just put in the chat, are we still sanitizing high touch surfaces on the playground at the beginning of each day? Is this necessary? We do still say, the CDC still says, in the childcare section, that disinfecting kind of those high touch areas are okay, but not to be doing a full disinfecting of all of your playground equipment, that it's really not necessary. But sometimes like your handholds, or if you're having kids, they're standing and waiting in line, and they're holding onto a railing, or they're doing something like that, then those are those great high touch areas that you would go ahead and disinfect. So that is still an encouragement. Okay, so the case reporting and outbreak responsibilities. So this document is still on the DHS website. It's back from March, and it's under review. So there's some information on there that we want to just make sure that you're aware of. But then I want to let you know that there's some quarantine guidance on there that does not follow the current recommendations. So just so you know that, and the exclusion criteria. So there's this document under review, and I'm not sure when that will change, when and if that will change. The regulated childcare, we still want programs to report, both homes and centers, to report individual cases to Department of Human Services staff, and then also to work with your nurse consultant on those cases, so we can kind of work through those specific questions. And I know that programs are still doing that, so I appreciate that. And then for outbreak responsibilities is if it's 3 or more in a child care center or home, that's when Department of Human Services and the Healthy Childcare Iowa, myself, we track that, and we still want those reported. We have not documented an outbreak for over a month, so it's been great to see that. We still have had a few little individual cases, very rare. I've had a few calls on some, but so that's great news across our state. That's really exciting to be over, maybe where we don't have to worry so much about that anymore. But just wanted to let you know that we are still wanting that dialogue from your agency to Department of Human Services and to the local nurse consultant to work through that. And then we do still say that if a COVID positive child or a symptomatic child, they really should follow that illness exclusion, childcare common illness exclusion criteria. And then there is information that children, if they're exposed at care, that was some information that was sent out that if they're exposed at care, that they're no longer required to stay home, regardless of mask usage. So that I know that we had some information initially about, if they had masks on or didn't have masks on and all that, but children, what we found is that children that are exposed have not really converted. Many times they don't convert to a positive case. So we have data to say that, children are really not as susceptible as maybe we had thought with some of that. And so as this illness, as this disease has additional information has been looked at in terms of data for COVID, we're able to say that, a child exposed at care should no longer be required to stay home. It's really up to the parents. The parents need to be given the information, and the parents can make their decision if they want to, have their child stay at home or not. Now, just so a little bit different in terms of like if it's household contacts exposure, but we're saying truly exposed at childcare. So that's a little bit different because local public health might give some different guidance if, say, if it's a child of an adult who in their home where they had an exposure that way. So I just wanted to kind of clarify that if it's children exposed at care, meaning they were exposed in the child care setting where another child or a staff person was positive in the past, we would quarantine. Of course, we would be encouraging quarantine for the whole class that was exposed. And that's not a requirement anymore. Kind of confusing, I know, but that's why the nursing consultants, that's why we're here. That's to kind of walk through all of those questions. So as I mentioned, the EPI manual from Iowa Department of Public Health did add COVID-19 under the reportable disease section, C through D. And I have the link there in case you wanted to look it up. But they do have a tab that's under controlling spread. So the EPI manual has pretty much every reportable disease listed and some additional diseases listed that are common in our state. And then they have different information in terms of what the responsibility is of local public health, what's the exclusion, what specific informations for different groups of people, schools included, and childcare and nursing homes and those kinds of things. So just so you know, under the controlling tab for COVID-19 in the EPI manual is the statement about local public health. So I'm just going to share that a little bit, that local public health should notify the childcare setting when there's a positive case, whether that was a positive case in either the provider, a staff person, or the attendee or the child, and then local jurisdictions and facilities can choose to kind of decide what's best appropriate based on their risk of community spread. So that could be different. And I know in Region 4, we have a lot of programs from a lot of different counties. So it's really your local public health or your local jurisdiction that's going to be looking at what is our community spread, what is our guidance going to be for childcare. So just so you know that it's not a requirement by facilities or for their staff to be doing contact tracing. That's local public health responsibilities, and that we're just kind of going to say that that whole kind of exposure and if people stay home is really going to be kind of decided at that community level. And then we always say if a child is ill or a staff is ill, they need to stay home. So and consider getting tested. So that's kind of the basic information to just remember that that if somebody's ill, they need to be home. And then we can kind of walk through what they need to do in terms of their exposure, if they were exposed or if there was something going on in the community. So that's what the local public health, that's why it's great to have local public health nurses, because we, our local nurse consultants work with local public health. We kind of know what, or if you contact me, I will reach out to the local public health entity, and then we'll kind of walk through, what is the best guidance for your program. Always erring on the side of caution, but then making sure that parents have the ability to make decisions based on the information that we have. I hope that was helpful. I don't see any chats. Does anybody have a question before I move on? I know that's a lot of information, and fortunately, it's probably information you're not too worried about right now because we haven't had that many cases in childcare. So that's the good news about all of this. So, and I so appreciate all of you for, I will say, we have really been blessed in this state that all of you as providers have been doing such an excellent job following our guidance documents, which I know has been challenging because it changes, but you've been very good about communication and reaching out and walking through questions and doing the best job with your, your screening kids at the door when initially we asked to have that put into place, and trying to work through all of those challenges that we ran into, and then the continuation of really the disinfecting and cleaning and keeping kids healthy and safe. And it really has paid off in our state because things have really gone quite well in our state for because of all of you and all the hard work that you've done. So I so appreciate that, and have been really all of our nurse consultants have worked really hard, and all of our CCR&R consultants working together with DHS to make sure that these changes are communicated, and we just appreciate any questions that you have, because that we know they're out there, and sometimes this is confusing information. So I appreciate your time. I'm going to just keep going since I don't see anything. Julie, unless you see something that I'm missing. Okay.
No, looks good.
Okay. So I just wanted to point you to our resources. Both, Department of Human Services has their COVID section, so you can always go on their website. You can go on the CCR&R website. They have, their resources for COVID on there. And then in our printed products section on our website. So if you go to Healthy Childcare Iowa and then you go to the printed products tab, you'll see we have a COVID section. And we still have our COVID section in there so that the links are quicker to get to. Some of the Centers for Disease Control or some of the links in Iowa Department of Public Health, you have to kind of search for them. And so we tried to put anything childcare related specifically on our website. And I know that CCR&R did the same thing. So we could just help you find the information if you need it. So I was going to jump into medication administration skills competency, which is changing gears here a little bit from COVID, but this is some information that I thought might be helpful, and it was some information that was shared with our childcare resource and referral consultants, as well as our nurse consultants, and wanted to share it with all of you. So we have a course, Medication Administration Skills Competency, and that's a 2-hour course, and it's really a course it kind of goes from what you've taken. You take medication administration as part of essentials, those pre-service trainings that you do online, and then this is kind of the next steps. This is the class that you would take to have a little bit more knowledge and skills around medication administration. So just wanted to kind of share, who should take this course, because we get that question a lot. So just wanted to share some information. We know safe medication administration in childcare is as crucial to, to the well-being, to the wellness of children. We know that nationally, as well as in the state of Iowa, we have more medications given to children in care than we ever have before. We have a lot of increase in our in the U.S. as well as in the state of Iowa in some of our chronic health conditions for children, including asthma and allergies, and so we really have seen an uptake of need for medication administration for those chronic diseases, as well as those short-term diseases like a child who returns to care after they've had an ear infection and they're on ear drops for 2 weeks, and so they need to have those done at childcare. So we have in our childcare regulation that all childcare providers, both centers and homes, are required to take those minimum health and safety classes through the Essential Series, and they take that basic medication administration. And then we have this next step of the skills competency course for really those childcare providers or staff that are responsible for administering medication. So they're the lead teacher, they're the person that's actually responsible in their room, or maybe you're in a program where you have one person who's kind of in charge of doing all medications in your facility. So you have those providers or those staff people that have that responsibility, and that's where we really want to say next step would be for those people that are responsible for that to take the skills competency. best practice, and this is not just best practice in childcare, but there's research on best practice in many settings, including nursing homes and in the hospital setting, that having a limited number of trained staff administer medications to children. And like I said, it's even research in other areas like in group settings, that it really helps that having a limited number rather than everybody administering meds really is best practice, and that's really to prevent medication errors. So that's our guidance around that skills competency, and why we say maybe not everyone in your program needs to take medication administration, but to designate those key individuals who are assigned that job duty. And that, like I said, that would normally be your lead teachers. And then also you would have a couple backups. So maybe your site director or the director themselves will kind of be that backup person. And then not having people administer meds that are maybe a floater, that they're not as familiar with those kids, and they kind of float from different rooms, or maybe they're a part-time person where they're not, that's not their primary position or primary job, or someone who maybe has limited time in the classroom with children. And the reason we say that is, if you give medications, especially for chronic illness, a child, you will know that medication that they're getting. And so if something seems different, you pick up on that sooner. Because if you normally give a child a certain medication, every day, say, right after lunch, and then one day you're going to administer that medication and it looks like a different pill to you, that's usually a red flag to say, oh, I think maybe something's changed. But if it's somebody who's just doing this on a part-time basis, they wouldn't know that. They wouldn't know that child and know the difference from one day to the next. So that's why we really say to limit it. The course and skills test out is worth 2 points in the quality rating system. So it's the course is good for 5 years, and the test out we recommend every 2 years for QRS, but just for general best. A little bit additional information. So there are some eligibility requirements for taking the medication competency course. The participant needs to be 18 years of age, and we've had that question come up, and that's because administering meds to another person, you need to be an adult and you need to be 18. Okay, so that's a requirement. And then we want the person who's administering medications to be able to read and understand prescription as well as non-prescription labels. And so that may be a challenge. So if that's a challenge for maybe one of your staff in your program, please reach out to me so we can work through that, because we can work through those issues on an individual basis. But the class is intended for individuals that are able to read and understand labels. Anyone who's taking the medication course, the skills competency course, needs to complete the essentials medication and childcare prior to entry. They need to be assigned the role of medication administration, and they need to have a passing score, a minimum of 80% competency on the test out. So there's 8 medications that they actually test out. This course is a 2-hour course. So the first hour is some PowerPoint and information, but the second hour is all about hands-on. And then after that class, that 2-hour course, then the nurse consultant would work then with the individual taking the course, and they would schedule in the third hour, but it's a one-on-one visit where you actually do the test out of the competency, and then there's a requirement for 80% competency in the test out. I said before, the course is approved for 5 years. It's on the iPower registry, so you know that. We did convert the course to virtual. I'll tell you, it's a challenging course to do virtual because it's a lot of hands-on, and so we've had to work around that, but we did put a protocol in place so we could continue to offer it all through COVID. The virtual option is going to probably go away once we get fully back up and running with in-person training, but just because of the logistics and the whole part of hands-on with that second hour of the class. the competency test out. It's a quality measure, and we usually say that should be part of that quality protocol every 1 to 2 years or whenever a medication error occurs. So for QRS, it's every 2 years, but I know for like NACI, they say 1 year. Head Start says 1 year. And then if you have a medication error, you can always reach out to your local nurse consultant and say, we had a medication error, and I think it'd be helpful for our staff to go through the competency again and just do a retest. So we have done that in the past. I did see a chat there in the chat box real quick. So Kay said, I have taken the skills competency and the skills test out over 5 years ago. QRS says it's only good for 5 years. Why is this? Do I need to take the whole course again? So you may, Kay, have taken that previous course that we had that was prior to Essentials, and it was actually a 5-hour course at that time. So that's changed. So the course now is 2 years, and it's good for 5 years, which also meets the other course requirements that we have in the iPower. Most of our courses are, valid for 5 years, and then that course certificate, and then not using that certificate again, you have to go repeat the course. But if you take the course now, it will probably be a lot different than maybe you took it in previous. Like I said, it's a 2-hour course, and then you'll do the test out. Good question. Hopefully that answered it. I just wanted to share really quick our map. Our nurse consultant map and contact information has been updated recently. We've had a couple just staff changes or a phone number change on it, so we just updated it in June. So if you haven't been on our website, you can go ahead and look at the map if you're looking for your local nurse consultant. And then on the kind of that top of the page is my contact information on there too. So if you have any questions, if you didn't jot that down at the first slide, just to know that my information is on there as well. And then any other questions? So that went kind of fast. I'll stop sharing my screen here.
Sure, and I had a couple questions too from a provider who was not able to be on. So we won't be able to really clarify as much, if we're answering her questions, but we'll do our best, and I can always follow up with her after that. So I think we maybe talked about this at the last meeting, Heidi, but can you touch on what's recommended as far as parents coming into schools or centers for dropping kids off and picking them up?
Yeah, so originally we had really said to limit that, and that has changed. So so that can change as part of your protocol, and it's really your decision as a program how you want to continue, if you want to continue kind of that drop off, or you're going to start allowing them back into the classroom. I know some programs are having signs on the door that say, if you're unvaccinated, please wear a mask if you're coming into the building. It's really, you're going to have to determine what's going to be best for your facility in terms of how you want to change any policy around that. So, but that's no longer a requirement or anything in our childcare guidance. Good question.
Absolutely. Great. Thank you. And then this provider was wondering if she may be able to merge her classes together again this coming year, that they typically operate like a partner class format. And they hope to return to that, being able to merge classes together. So any recommendation you have around that?
Yeah, I think, we're, like we've kind of said from the beginning, is, things change. So I'm wondering if we'll probably have some additional guidance that will come out prior to school entry in terms of kind of, we're still trying to keep those, what we would call like cohorts or pod groups kind of together and not doing a lot of mixing. Because we know that has been effective for prevention of spread of COVID. As we move through the next few months and we start, we're seeing additional fully vaccinated individuals and less community spread, I know that will evolve as well in terms of moving away from kind of the pod or the cohorts into kind of those mixed groups. Best practice would be that you would still try to limit that mixing between groups, but it's really up to your program and your area deciding how you want to do that at this time. that really is your decision. So best practice, though, I know that the CDC still says that is best practice at this time. And I say at this time because it changes. So I could foresee that could be different over the next few months. So.
Right, sure. And like you said, they'll probably come out with some new things before the school year. I think this provider probably operates more around the school year, because her last question was, will the rigorous cleaning requirements that they had the last school year be lifted or changed at all? And other than, you know, it probably will change again and again by that time. If you have any advice around that.
Yeah, I will just say that I think one thing that we have really, and it's anecdotal, but we had a very great cleaning, disinfecting, cleaning, sanitizing kind of protocol in our state. I will say you all have done an excellent job with following those guidance documents, and then I think we really changed that probably around the essentials. We really put an emphasis on that. But I know all of you have done a great job with that before, but we really helped kind of even show some videos of what are we talking about when we're talking about, the difference between cleaning, disinfecting, and sanitizing. So I think we'll want to stay with some of that, keeping that, because I think that has really helped keep people healthy and safe. And we do know that it probably has helped keep a lot of infection spread, prior to COVID and beyond COVID, beyond the pandemic, that it's still a good practice. Probably not the same extensive level, though, maybe as what we were doing with COVID precautions. So just to be continued. I think that could possibly change, but still putting those practices in place. I think all the hand washing has been great.
Yeah.
I think the kids have all done a great job, and so have the staff on that. So
absolutely, and hopefully they're a little bit used to it by now, so it's just kind of second nature. So that's one of the good things about having to do something so many times.
Yeah, that, and I've seen so many people, because they were used to wearing masks, and now that they don't have a mask, doing cover their cough with their elbow and not their hand. I think it's just, people are so aware that maybe they weren't aware in the past. So
yeah, always positive things. So are there any other questions from providers that are on? Maybe you have a question specific to your program, or we can, always schedule another one of these. I try to do one every few months. So maybe around back to school time, there'll be some more guidance that we can touch on at that time. But we welcome any other questions you might have.
Or I'd love to hear what other programs are doing, or how they've worked, kind of worked in their system of protection, around kids, around the COVID pandemic. So if anyone has anything they'd love to share to the group, I think that's always really helpful, and I love to hear those stories.
Kristen asks, at this point, are we unsure of what quarantine guidelines will be for children exposed in their home?
So I would pull it up maybe verbatim,
sure.
but
yeah, you can. Here you go.
Yeah, let me just see if I can.
Sure.
We'll see if anything else comes for oops. I'll just look up that language real quick, okay?
Sure.
And if there's any other questions, somebody can
jump in or get to typing in the chat box.
Okay, so So the child you're saying a child exposed but not having symptoms. Is that what the question is? I think that's the way I read that. So this is what it says in the EPI manual. It says contact tracing should focus on household contacts and identifying those close contacts that are in a congregant setting. So not including childcare, that'd be more like the household contacts. And then it says household contacts are defined as those living in the same household as the infectious person. And then it just says that they'll look at those contacts, and then the local public health then will determine the exposure, and then if there would be any exclusion around that. I'm just looking here, so. Yeah, so it's then when it comes into childcare, it's just saying that, let's see. That, yeah, it's really going to be local jurisdiction, choosing to decide what's appropriate for the risk in their community. So if that contact tracing is done and they determine that that child should be excluded, then they would make that as a recommendation from your local public health. So I don't know if that helps.
So just continuing to present those to their nurse consultant and taking those case by case, pretty much?
Yes, I think that, and getting that guidance either from their local, local public health or local nurse consultant. And if sometimes it's easier to just call the nurse consultant, and they might have already talked to local public health that day, and so they might already have that information to share with you. Because I know sometimes when you call local public health, you might not be able to talk with someone immediately. You might have to be called back. So, and then I did see just a note. So we have a child who is out with a fever, and we requested that they get tested for COVID. Does the sibling need to be out and tested as well? No, we are not including siblings in that. So good question.
Great. And then a nice comment from Heidi Ball. She just wants to thank you, Heidi Hotvedt, and all the nurse consultants that for working with providers and all the help and the guidance over the last year, and that she really appreciates it so much. So that's great.
Well, thank you very much. I appreciate that. So, and then just, yeah, I just think really those case by case, and we don't, I'm not sure, with your group, if we've had, I don't know if we could do a show of hands or whatever, but I'm just wondering if you've had a lot of cases. What my understanding is, it's been very few in the state of cases. So we haven't had, especially in the last few weeks. So hopefully that's true. And like I said, I really just get the calls when it's an outbreak, and haven't had one of those, for a month. So that's a really good thing, great thing.
Yeah, absolutely. Really nice that it's not, like you said, too big of an issue anymore. So Cynthia says, thank you very much for the productive information. I'm glad you were able to join us, Cynthia. So Heidi's information too is up here on this slide. You can always contact her, or you can contact me. My contact information is here on the next slide. I probably sent you an email to invite you today, so feel free to reach out to me as well if you have any questions for Heidi, or if you have any questions for your child care consultant. I can get you in touch with the right person if I can't answer your question. So the link to access the recording of this meeting will be sent out via email. So if there aren't any other questions or comments for either of us, then you all are free to go today. Lots of thank yous in the chat.
I'll follow up on that stand play and let you know. I have someone that kind of is a contact that works with the CDC on some of the guidance, because I don't think it's specifically listed in their information on the website. So, but I'll do some checking and then get back to you, Julie, and you can share it.
Absolutely. Great. Thanks, Heidi. Appreciate you
Thank
being
you.
on today.
Have a great day. Thanks for
You
having
too.
me.